The following presentation is on Zetia. There will be two presenters for this podcast. My name is Todd Omrine, the first presenter. I'm the training manager for the WELCHOL brand team. With me today is Carolyn Silverman. Carolyn?
Hi, as Todd said, my name is Carolyn Silverman. I will be your second presenter today. I am a registered dietitian and certified diabetes educator. I am the national manager for the WELCHOL Clinical Educator Program. WELCHOL clinical educators are field-based and provide basic information on type 2 diabetes and primary hyperlipidemia, tips for maintaining a healthy and active lifestyle, and strategies to help adult patients stay on therapy.
Thanks, Carolyn. Let's get started. This is for your information only and is only intended to be a summary of information relating to Zetia. Do not use this information to make a comparison of WELCHOL efficacy or safety information to Zetia, as no head-to-head studies have been performed with WELCHOL.
These are the 6 major classes of drugs affecting lipoprotein metabolism. Remember that the NCEP ATP3 algorithm does not specify with which agent to begin therapy, but emphasizes LDL-C lowering with statins first. After that, an HCP can choose to increase the statin dose or add on any of the agents you see here. This presentation is on the cholesterol absorption inhibitor class of drugs and the only branded single-ingredient CAI available, Zetia.
Zetia is primarily used as an adjunct to diet to reduce LDL-C, total C, and ApoB alone or in combination with a statin for patients with primary hyperlipidemia. There are 3 other indications that will be discussed later. Zetia is the only single active ingredient CAI available in the U.S. market. It was approved by the FDA in 2002 and is marketed by Merck. Vytorin is a combination of ezetimibe, which is Zetia, with simvastatin, which is Zocor.
For individual product features of Zetia and Vytorin, I refer you to the individual package inserts. However, let's take a look at some of the key features of Zetia utilizing PADDOX, which stands for pharmacology, adverse events, dosing, indications and efficacy, contraindications, and the supplied form. Zetia is absorbed into the bloodstream and passes through the liver. Zetia appears to inhibit the absorption of cholesterol at the brush border of the small intestine. This causes the liver to increase collection of LDL-C from the blood, which reduces the blood levels of LDL-C. Let's take a closer look.
Intestinal cholesterol is derived primarily from cholesterol secreted in the bile and from dietary cholesterol. Zetia is a systemically absorbed prescription medicine used to lower levels of total cholesterol, ApoB, non-HDL-C, and LDL cholesterol in the blood as adjunctive therapy to diet. Dietary cholesterol in the form of lipid emulsions combines with bile salts to form salt micelles, from which cholesterol can be absorbed by the intestinal cells. Zetia localizes at the brush border of the small intestine. The molecular target of Zetia has been shown to be the sterol transporter Niemann-Pick C1. Inhibition of the receptor site blocks the intake of cholesterol into the cell. This leads to a decrease in the delivery of intestinal cholesterol to the liver and causes a reduction of hepatic cholesterol stores and an increase in clearance of cholesterol from the blood. This distinct mechanism of action is complementary to that of statins and fenofibrate.
Most common adverse reactions for Zetia when administered alone are upper respiratory tract infection, diarrhea, arthralgia, which is joint pain, sinusitis, and pain in extremity. Most common adverse reactions for Zetia when co-administered with a statin are nasopharyngitis, myalgia, upper respiratory tract infection, arthralgia, and diarrhea. Zetia is not recommended for patients with moderate or severe hepatic impairment. When Zetia is added to a statin, persistent elevation in hepatic transaminase can occur. Myopathy and rhabdo have been reported in patients using Zetia alone or a Zetia-statin combination. Zetia is pregnancy category C. When used with a statin, it is contraindicated in women who are pregnant or may become pregnant. Zetia comes in 10 milligram tablets taken 1 tablet once per day, with or without food. It can be taken at the same time as a statin and should be taken at least 2 hours before or more than 4 hours after administration of a bile acid sequestrant. Other drug interactions include cyclosporin, fenofibrate, fibrates, cholestyramine, and warfarin. Zetia is not recommended for patients with moderate or severe hepatic impairment.
Zetia as an adjunct to diet has 4 indications. Zetia is indicated in patients with primary hyperlipidemia to reduce elevated total cholesterol, LDL-C, ApoB levels, and non-HDL-C alone or in combination with a statin. Used in patients with mixed hyperlipidemia to reduce elevated total C, LDL-C, ApoB, and non-HDL-C in combination with fenofibrate. Used in patients with homozygous familial hypercholesterolemia to reduce elevated total C and LDL-C in combination with atorvastatin or simvastatin. Used in patients with homozygous cytosterolemia to reduce elevated cytosterol and composterol. Its limitations of use include the effect of Zetia on cardiovascular morbidity and mortality has not been determined, and Zetia has not been studied in Fredrickson type 1, 3, 4, and 5 dyslipidemias. Efficacy will be discussed on the following slides. When combined with a statin, contraindications of Zetia include active liver disease, including unexplained persistent elevations in hepatic transaminase levels, pregnancy, and lactation. Zetia comes in the form of 10 milligram tablets.
Zetia was studied in 2 multi-center, double-blind, placebo-controlled, 12-week studies in 1,719 patients with primary hyperlipidemia.
In these studies, Zetia significantly lowered LDL-C 18%, total cholesterol 13%, triglycerides 8%, ApoB 16%, non-HDL-C 16%, and increased HDL-C 1% compared to placebo. Maximal to near maximal response was generally achieved within 2 weeks and maintained during chronic therapy.
In a multi-center, double-blind, placebo-controlled 8-week study, 769 patients with primary hyperlipidemia, known coronary heart disease, or multiple cardiovascular risk factors who were already receiving statin monotherapy but who had not met their NCEP ATP2 target LDL-C goal were randomized to receive either Zetia or placebo in addition to their ongoing statin.
Zetia added to ongoing statin therapy significantly lowered total C, LDL-C, ApoB, non-HDL-C, and triglycerides, and increased HDL-C compared with a statin administered alone.
In 4 multi-center, double-blind, placebo-controlled 12-week trials in 2,382 hyperlipidemic patients, Zetia or placebo was administered alone or with various doses of atorvastatin, simvastatin, pravastatin, or lovastatin.
When all patients receiving Zetia with a statin were compared to all those receiving the corresponding statin alone, Zetia significantly lowered total C, LDL-C, ApoB, non-HDL-C, and triglycerides, and with the exception of pravastatin, increased HDL-C compared to the statin administered alone. LDL-C reductions induced by Zetia were generally consistent across all statins. You can see the pooled results from tables 8 and 9 here with atorvastatin and simvastatin. Here are the pooled results from tables 10 and 11 with pravastatin and lovastatin.
Zetia was studied in combination with fenofibrate in a multi-center, double-blind, placebo-controlled clinical study in patients with mixed hyperlipidemia. 625 patients were treated for up to 12 weeks and 576 for up to an additional 48 weeks. Patients were randomized to receive placebo, Zetia alone, 160 milligrams fenofibrate alone, or Zetia and 160 milligrams fenofibrate in the 12-week study. After completing the 12-week study, eligible patients were assigned to Zetia co-administered with fenofibrate or fenofibrate monotherapy for an additional 48 weeks.
Zetia, co-administered with fenofibrate, significantly lowered total C, LDL-C, ApoB, and non-HDLC compared to fenofibrate administered alone. The percent decrease in triglycerides and percent increase in HDLC for Zetia co-administered with fenofibrate were comparable to those for fenofibrate administered alone. The changes in lipid endpoints after an additional 48 weeks of treatment with Zetia co-administered with fenofibrate or with fenofibrate alone were consistent with the 12-week data displayed.
Cytosterolemia, also known as phytosterolemia, is a rare lipid metabolic disorder. It is characterized by hyperabsorption and decreased biliary excretion of dietary plant sterols, leading to hypercholesterolemia, premature development of atherosclerosis, and abnormal hematologic and liver function test results. Only 45 cases have been reported worldwide. It is treated by strictly reducing the intake of foods rich in plant sterols, such as vegetable oils, olives, and avocados. In this multi-center, double-blind, placebo-controlled 8-week trial, 37 patients with homozygous cytosterolemia with elevated plasma cytosterol levels greater than 5 milligrams per deciliter on their current therapeutic regimen were randomized to receive Zetia, N equals 30, or placebo, N equals 7.
Zetia significantly lowered plasma cytosterol and composterol by 21% and 24% from baseline respectively. In contrast, patients who received placebo had increases in cytosterol and composterol of 4% and 3% from baseline respectively. For patients treated with Zetia, mean plasma levels of plant sterols were reduced progressively over the course of the study. The effects of reducing plasma cytosterol and composterol on reducing the risks of cardiovascular morbidity and mortality have not been established. Reductions in cytosterol and composterol were consistent between the 8 patients taking Zetia concomitantly with bile acid sequestrants and the 21 patients not on concomitant bile acid sequestrant therapy.
We've walked through some of the PI of Zetia. Thus, you can see that Zetia has indications for several lipid reductions. Now let's take a look at the ENHANCE study. The ENHANCE trial was published in the New England Journal of Medicine in April 2008. The trial examined whether 10 milligrams of Zetia plus 80 milligrams of simvastatin versus 80 milligrams simvastatin alone could reduce the progress of atherosclerosis as assessed by ultrasound measurement of carotid artery intima media thickness, or CIMT, which is considered to be a validated surrogate marker for atherosclerotic disease. ENHANCE was a double-blind trial which enrolled 720 patients with familial hypercholesterolemia, aged 30 to 75 years old, whose LDL-C level was greater than or equal to 210 milligrams per deciliter after a 6-week run-in period, during which all lipid-lowering drugs were discontinued.
After 24 months, the combination treatment group of simvastatin and Zetia, which are the same components and dosage strengths of Vytorin, had significantly better reductions in LDL-C, total cholesterol, triglycerides, ApoB, HDL-C, and CRP versus the simvastatin-only group. Despite the additional 16.5% reduction in LDL-C and the improvement in other laboratory values, the combination treatment group did not demonstrate a statistically significant difference in changes from baseline in CIMT, which was the trial's primary endpoint.
The authors discussed several possible reasons for the trial's lack of outcome. They mentioned that it is possible that the inhibition of HMG coenzyme A reductase leads to a plethora of lipid-independent effects involving anti-inflammatory action and improvement in endothelial function. According to the authors, it can be argued that certain lipid-independent effects of statins that are not shared by ezetimibe are involved in vascular benefit.
Figure 3 shows the CIMT primary endpoint results and that lack of difference.
The SHARP study was published in The Lancet in June 2011. In this trial, 9,270 patients over 40 years of age with chronic kidney disease and no known history of MI or revascularization were randomized either to combination treatment with Vytorin, 10-20 milligrams daily, or placebo. Approximately 1/3 of participants were on dialysis. Although lipids were measured, there were no lipid inclusion criteria. The primary outcome was first major atherosclerotic events.
After a 4.9-year follow-up, the components of Vytorin lowered LDL-C 33% and was associated with a 17% relative risk reduction in major atherosclerotic events versus placebo. Please remember that the active treatment group of simvastatin and ezetimibe is Vytorin, and that this was the components of Vytorin versus placebo, not Vytorin versus Zetia, or the individual components alone. The study design therefore precluded drawing conclusions regarding the independent contribution of either ezetimibe or simvastatin to the observed effect. The SHARP study therefore does not shed light on whether Zetia provides any additional benefits when given on top of simvastatin, or if simvastatin, given alone, would have accomplished the same thing if there had been a simvastatin monotherapy arm. The results of SHARP show that the reduction of LDL-C with the components of Vytorin, 10-20 milligrams a day, safely reduced the incidences of major atherosclerotic events by 17% in patients with advanced kidney disease over the course of the 4.9-year follow-up. The FDA allowed inclusion of the SHARP trial in the Vytorin label, but not the Zetia label, to reflect the reduction in LDL-C and the demonstration of reduced risk of major vascular events in the chronic kidney disease population. The most recent Vytorin PI, under limitations of use, continues to state that no incremental benefit of Vytorin on cardiovascular morbidity and mortality over and above that of simvastatin has been established. Likewise, the Zetia PI still continues to state that the effect of Zetia on cardiovascular morbidity and mortality has not been determined. You can find more information on Zetia and Vytorin by visiting the WELCHOL resource website. On the website, you will find the WELCHOL Home Study binders under the Learning Tools tab. 2 modules specifically will help you: diagnosis and management of lipid disorders, as well as WELCHOL in the marketplace. The package inserts for full prescribing information, the 2-page summary fact sheets, the online CAT, which is playable on both your laptop as well as your iPad, the 2012 Meet Your Marketplace Guide, which you can also order through Kinetics, and various training bulletins addressing this class of medicines. Thank you for participating and viewing this podcast. Special thanks to Carolyn for co-presenting.
Thank you, Todd.
Have a good day.